Welcome to the Laser Pulse Learning module on Dissemination Planning. Dissemination is a critical but often overlooked part of the research process. In research translation, having a well thought out dissemination plan is of absolute necessity to make sure that the findings impact policy as well as practice. Hello there, my name is Matt Alsma. I'm a professor at the Indiana University School of Medicine. I also direct the Adolescent Behavioral Health Research Program. That includes scientists that focus on the health and well-being of adolescents, in particular their behavioral health. I've had many years of experience conducting community-based implementation research, and I'm looking forward to talking with you today. We have 3 objectives for our time together. Our first objective is for you to leave this talk understanding how to plan for dissemination. A second is to clarify the importance of early engagement for effective dissemination. And our last objective is for you to know how to utilize a tool we have developed focused on dissemination. When planning for dissemination, there are a number of different components to consider. First, we're going to talk about what dissemination is, why we should focus on dissemination, and some thoughts on how we can improve dissemination efforts. We will then discuss why it is important to plan for dissemination prior to even starting a project. Thereafter, we will highlight the basic elements of dissemination planning. There are several. One element we will spend some time on is the use of research liaisons or champions. The Laser Pulse team has developed a tool that can be used for dissemination. We're going to review that tool and again emphasize how dissemination is different based on where the project is in early, mid, post-implementation. The last discussion point will be lessons learned from our team's work in the field in general. Why should we even discuss dissemination? A classic difficulty is the translation of evidence-based interventions to the community. Research has shown time and time again that it takes almost 2 decades for evidence-based practices to become routine within healthcare and community settings. We, as academic partners, really need to tackle this gap. There are multiple ways to limit that research to practice gap. One way is through effective dissemination of research. That is a core pillar to the embedded research translation model. The embedded translation model highlights the fact that the research project is iterative, where co-design occurs with academics, practitioners, and other stakeholders, including community members. The goal of co-design is to utilize the knowledge that all individuals have to tackle a developmental challenge. It is important to highlight that this iterative process builds upon knowledge gained to make constant improvements. Dissemination represents the right-hand tail of this graphic, where your efforts to engage stakeholders before, during, and after your research culminates in increased awareness, potential opportunities for replication and improved scale, wider application, and ultimately, impact. Importantly, dissemination is one of the 4 pillars of the embedded research translation model. Without explicit efforts to improve dissemination, research findings may not have nearly as large of an impact as is possible. Here you see a commonly used definition for dissemination. Dissemination is an active approach of spreading evidence-based intervention to the target audience via determined channels using planned strategies. There are several key words to highlight in this definition. First, this is an active process. The opposite of active, obviously, is passive. Dissemination is not merely waiting until the end of the study and publishing research results in an academic journal. Dissemination is planned, not haphazard. Actively engaging with stakeholders throughout the process in a planned manner is a key element of dissemination. Dissemination is a targeted process, not happening only by chance. We as academic partners should target audiences for dissemination at the beginning of the project. Lastly, strategies are utilized to make active, planned, targeted dissemination activities. All of these activities and strategies are informed by a theoretical framework. This framework should not only guide the science, but also dissemination. When discussing the importance of dissemination, it's often helpful to have an implementation framework or model. For example, the Consolidated Framework for Implementation Research, or CFIR, is one that incorporates both inner and outer settings within this model. Inner settings include individuals involved in the actual intervention. For instance, much of my work involves criminal justice agencies to improve screening and engagement with needed services. This necessitates collaboration with judges, probation officers, police officers, and court staff to enact new interventions. Moreover, the outer setting is important. There are multiple internal and external policies in the outer setting that are impacted by new interventions. For example, when we think about the example of screening, the screening results can or cannot be used in the setting are impacted by local policies. This includes how the questions are asked. Is the parent in the room when adolescents are asked about their substance use? How is the information gathered used to actually help a young person? There are multiple state policies that are impacted in this work. When we apply inner and outer settings to dissemination, we have to consider both settings when designing a dissemination plan. This is where individual research comes to play and the importance of planning at the very beginning of a project. It is important to plan for dissemination at the beginning. Planning for dissemination before our project even begins, stakeholders can then inform the research questions. Not only can stakeholders inform research questions, but also the process for completing the research. It might be that a researcher or a team does not have the relevant stakeholder identified. One possible laser pulse exercise to consider is a stakeholder analysis. A template is available through the Laser Pulse website. It can be helpful in identifying relevant stakeholders not only for dissemination, but also for project execution. There can be a number of policies that impact the project. Identifying stakeholder and policymakers, as well as influencers, can not only help with dissemination, but success. Policymakers do not have to be at the national level. There are clear policies that impact local, nonprofit, county, NGO processes. A common policy our team addresses at the beginning of projects are data sharing agreements. Just saying those words sends a shiver down my back. So completing screening, referral, treatment, engagement necessitates data sharing, sometimes between HIPAA compliant and non-HIPAA compliant institutions. That's definitely a U.S. component that we battle with. This is a U.S. phenomenon that brings another layer of policy complexity to project completion, and it brings risk-averse lawyers to the research table. Addressing relevant stakeholders, in this case, lawyers, prior to the project can help with project completion and eventual dissemination. Policies can also be at the practice level. For instance, in a recent implementation project to expand the evidence-based treatment of substance use, we did so by implementing motivational enhancement cognitive behavioral therapy, or MET-CBT. We're utilizing an online artificial intelligence program to rate therapists on their fidelity to this MET-CBT model. One practice barrier that was unexpected included provider hesitancy to allow uploaded therapy sessions to be coded within this secure, HIPAA-compliant environment. To be clear, both of these examples relate to practice and policy barriers to completing a project. There are also practice policy barriers that impact dissemination. This includes the ability to hire a local champion or partner with a local champion to aid in dissemination efforts. When we talk about dissemination as a planned activity, it's important to recognize the multiple players that exist in a given project. They include researchers, practitioners, policymakers, community members. Motives for dissemination differ depending on that group. As a researcher, we're really motivated to disseminate novel findings. Practitioners are really thoughtful about how does this actual research impact my practice. For policymakers, they're really interested in how to change payment structures, healthcare systems, treatment activities. For community members, they really want to know what's been learned about me, my family, my community. Is this right? Is this valid? Do these results make sense? And then for the private sector, is this product viable? How does that impact CSR and following activities? And then for donors, does this product warrant dissemination? Does it reflect standards that impact future work? So you can see those motives could be complementary. They could be in conflict. They're definitely different depending on that audience. When we think about researchers, the standard dissemination for us academics includes conferences and research papers. These are very important outcomes. They inform the research literature. They help drive innovation in that setting. Now, dissemination as a planned activity is planned in part and parcel to National Institutes of Health funding, private funding. There now needs to be a dissemination plan at the very front end. I've had the opportunity to be a standing member of the Implementation Science Study section. I will say that dissemination plan is definitely something that is read, is valued, and it's a great time to show forethought of dissemination as an active, planned, and targeted plan. Researchers should highlight creative ways for dissemination. Online platforms such as ResearchGate can disseminate information in academic settings. Obviously, the news media. There are researchers that have a very strong Twitter presence that aids in dissemination as well. Another individual to think through is actual practitioners. There can be tension between researchers and practitioners with dissemination. Practitioners commonly want to really understand how to make changes for the betterment of individuals that they serve right now. That is important. We as researchers should encourage those champions to make needed changes. There are a number of applied conference meetings that are strong vehicles for dissemination. In our own work at state and national meetings, for instance, for probation officers, parole officers, police officers, individuals attending conferences to change practice, those are really great tools for dissemination. There are also multiple newsletters, online blogs, and chats that are relevant for disseminating information to practitioners. There are academic researchers that specialize in policy making. Then there are the majority of us where policy making is not the focus of our work. With that said, we can still consider the multiple levels of evidence-based policy making upon which our results can impact. This recent article highlights a learning health policy system approach. A learning health system takes in information, implements evidence-based practices and policies, and looks at how it went. Did that policy affect change? Should it continue to be innovating? Similarly, this article highlights the possibility of innovating in multiple policy levels, state, local, nationally, to improve outcomes amongst people and systems. It's a really nice approach to consider. Community members, for me, for many of us, are the first group of individuals when considering dissemination. For many of us, we are gathering information from community members, and we need to make sure that they are engaged at every step of the project, particularly when we get to dissemination. At a minimum, it is important to share information with local stakeholders on the results of a research study. There are a number of venues for dissemination. Public spaces are a great way. Library, shared spaces, church events, worship centers. Bringing food is always wise. This is also where local champions or research liaisons can be vitally important, and they can bring a level of creativity and passion to dissemination activities. This is where poetry and storytelling can come into play. There are multiple stories of song and dance and theater being utilized for dissemination. Again, this is where we really need to hear from local champions, research liaisons, to determine how to best employ community members to disseminate information in a great way. So when we're thinking about dissemination planning, we're going to highlight this embedded research translation model. There are several aspects to effective dissemination. It is vital to engage knowledge users and stakeholders very early in the process. This is where co-design can really happen. We need to anticipate that there will be time taken for dissemination and resources will be needed. There are always unexpected expenses with research projects. The needed resources should be anticipated at the very beginning of the project for strong dissemination in the middle and at the tail end of a project. Engagement is encouraged through formal and informal ways. A formal way would be a PowerPoint presentation at a community meeting held at a relevant NGO. Much of the work with our group focuses on implementation of evidence-based treatment through organizational change and cross-system collaboration. As such, we tend to rely on formal presentations with individuals employed within these agencies. As we all know, one effective way to getting people to meetings is free food. There are also a number of informal ways to engage knowledge users and stakeholders. Informal examples include branding with t-shirts, flyers, signage, community gatherings, having a booth, having a physical presence in a public space. More creative engagement could be dance, storytelling, theater, and then language matters. There are terms that immediately bring to mind significant instances of injustice. This is where local community members are so important. Just the other day, I was describing to a colleague a parent training intervention. This is a term used in my circles for many years. The intervention is strong, evidence-based, helping parents to monitor adolescents, how to engage well. But that phrase, parent training, that's loaded with meaning. I hadn't really even thought about it. What does it mean that a parent needs to be trained? My colleague pointed out that training brings to their mind an animal training program, not engagement and empowerment, rather images of discipline, negative power differentials. How can we know if the language being used in dissemination has negative connotations? Check with our stakeholders. They will tell us. Storytelling approaches can be another training offered. This is an example within Laser Pulse, and dissemination really needs to be a long-term, trust-building, agency-driven process. Here are some additional tips when considering tailoring for implementation and specifically dissemination. So tailor the products for the different audiences. Definitely use accessible language. This is where community partners do need to drive that conversation. And consider a tiered approach to dissemination. For some audiences, maybe there are pithy phrases on a poster or flyer or some other information that are sufficient. And then for other individuals, maybe there is a white paper that's a page, 2 pages with figures that are more dense that would be appropriate. So know the audience. Be creative. Think about that in terms of types and locations for dissemination, and avoid the inclination to fall back on a poster presentation and consider using your own pedagogical skills. This will help us be more creative, more open, having a thoughtful atmosphere, rather than using the methods-heavy academic conference presentation that a lot of us academics, that's what we fall back on. So try innovative methods. Fishbowl discussions, chalk talks, fireside chats, knowledge cafes, think-a-thons. All of these phrases really do get at more innovation with communication. Consider using local knowledge for that means for effective dissemination. We're now going to shift toward examining how to apply the Laser Pulse Dissemination Planning tool for your work. We've divided this tool into 3 sections. First, we're focusing on the beginning stage of the project. It may appear counterintuitive to plan for dissemination when that dissemination occurs at the end. However, as we've highlighted several times, dissemination is a planned activity, and planning early aids stakeholders, will help lead to a more successful dissemination. Going through the early stage will help guide that process. It's vital to identify partners engaged in this process. It may also be helpful to conduct a formal stakeholder analysis. This is a laser pulse template that's linked within this tool. A last early stage consideration includes human and financial resources necessary for dissemination. Funds may need to be set aside at the very beginning of the project to make sure that dissemination happens in a successful way. Alternatively, you may find that it's necessary to seek other funding avenues for this planned activity. Working through this handout will help for that planned activity later on at the end of the project. Early stage considerations including having a documented process of engagement. This can be specific to the stakeholder group. Some mediums and format work better for specific stakeholders. And I've mentioned resources. I was emphasizing financial resources, but really we need to think about stakeholder, champion, staff time. That's an important, valuable resource. Space is important. Community goodwill. When we're taxing our community members too much with some of our research activities, could that cut into that resource that we have within the community? All of these are important resources beyond simply financial resources. There are multiple goals with a mid-project check-in. One goal is to make sure stakeholders are involved in the project, that they are actively involved, that they're part and parcel with you in completing the goals of that project. Another goal is to reassess engagement and need. For instance, multiple projects have been implemented by the COVID-19 pandemic. It might be that resources need to be reassessed, timelines adjusted. Perhaps there's a new community that has come to bear with your intervention, with your research project, and maybe system partners need to be re-engaged. It's important to think through this at that mid-project checkpoint to really keep that engagement moving forward well. Upon project completion, analyses are clearly being conducted. Engaging stakeholders to assess the interpretation of the outcomes is part of the dissemination process. Do the results make sense? Are they valid? What are some of the impacts of these research results on community practice? Stakeholders have important perspectives on outcomes. That's going to aid interpretation. It will aid in the language used by academic partners, and it will make sure that the necessary partners receive this information. There may be an additional stakeholder group that needs to be engaged at the tail end of this project to make those results actionable at multiple levels. Moreover, dissemination is the last step of the possible expansion of your work. Thinking through audience, products, project champions, that's going to aid in strong dissemination. We are hopeful that this tool will be helpful when considering dissemination and how best to connect with stakeholders. You may find that having brief summaries of research results being available to partners is helpful. Having a long, dense academic article might be ideal for some partners. For others, you might need to do some more translation. Here's an example from our partners. We conducted an intervention through an Indiana University research program in partnership with the Interdisciplinary Research Leaders Program at the Robert Wood Johnson Foundation. This brief was distributed to staff members and leaders at the Indiana Department of Corrections. Prison staff members completed this survey. They were involved in a training project, and it summarizes in lay language the results of this study. Now, this product ultimately aided in dissemination efforts. This is more dense than perhaps what you would want to use with your community members depending on the audience. For our audience, this was an effective way to engage, disseminate, and help them think through next steps with the project. There are several key principles to highlight at the end of this talk. Research liaisons and champions are incredibly important. They can make or break implementation-focused projects and obviously dissemination. Relatedly, there is an important role for community advisory boards. Increasingly, when I have seen research projects, implementation projects come through study section, they have a community advisory board. However, the extent to which individual projects and academicians utilize community advisory boards varies widely. Some community members simply advise. Others have a much more robust, engaged process where community advisory boards are involved in community-focused participatory research projects. Regardless, it is vital to engage community members, and a community advisory board is one way to do so. When in doubt, fall back on your implementation framework. This model has guided your project from inception and can now guide dissemination. Chances are there will be fiscal, staff, and time impacts to strong dissemination activities. Early planning will help with that. Anticipating these impacts early is something we've discussed often. I'd like to highlight that this is one need often overlooked. One of the more difficult aspects of community engaged work, for me at least, is moving on to the next project. Ultimately, as community engaged researchers, we want to and need to stay connected with individuals we've worked with for the past months and years. That connection should continue. With that said, there are times when a project has reached its end and it's time to move on to the next project and perhaps to expand to another community. This is one of the fundamental aspects of community work, and sometimes that can be difficult. Explore this with your partners, stakeholders, feasibility, really think through. This is one of our roles as academics. Lastly, there are multiple ways to actually measure the effectiveness of your dissemination. Part of evaluation of dissemination is feasibility and acceptability. Do stakeholders appreciate the information? Do research results guide their own work? Has a change in policies and practices at a local level occurred based on this work? There are multiple ways to actually measure that dissemination, and those are outcomes to explore in the future. So this concludes the Laser Pulse Learning Module on Dissemination Planning. Please refer to the Dissemination Planning tool attached to this module. Reference it as needed, and you have access for these slides and thinking through dissemination for your own project. There's also additional readings after this next slide. You can certainly go through, look at these additional readings, and we also encourage you to conduct an evaluation on the effectiveness of this talk. Thank you for your time.